So go ahead and find a motion.
This, right here,
Go ahead and do it again.
right there. It's any kind of squatting or kneeling.
And just because it kept switching back to me because I was talking,
Okay.
do it one more time because now I've got it locked on you.
Right there.
Okay, now go ahead and do it to the other side.
Okay.
Any problem?
No.
Okay, based upon the rules, do you have a good and a bad?
Mm-hmm.
Okay, so if you had both bad, you would have gone down on your left side and said, no, that bothers me, Tom. But you didn't. Okay? So guess what we're going to do to try to fix it?
Gonna exercise the good side.
Yes. Now, before we do, we want to give a pre-test score to that right side. So we use a similar scale of 1 to 10, like the pain scale, but we use 1 to 100. A 1 to 30 is low, a 40 to 60 is medium, and a 70 to 100 is high. Okay? Now, we're not just looking for the sensation that you have, which is what everybody wants to gauge it toward, which is usually the pain. But I'm also wanting you to be aware of the motion on that bad side as comparison to the good side. I want you to equate to the stability and the speed in which you're able to go. So you'll probably notice on the bad side, you're more cautious, you're slower, you don't go as far. And then you're going to go to the other side and you go, oh, I got a lot more. It's freer. It's even freer up in the hip, even the spine, everything. And then you're going to give me that number. But don't think too much about it. Okay?
Tom, you want me to do just one-legged squat, right?
Just one-legged squat. Well, I mean, you can put some weight on the other one. It was fine the way you did it. Okay?
All right.
Test again to the right, just because we're going to do it one more time to give a number. See where you get to.
Okay.
Good. Now you guys see the little catch she gets.
Yep.
Now compare that to the other side. All right. So
it's severe. It's
70 to 100.
Yeah, definitely.
Which one? You gotta give me a number.
70 to 100.
That's 30 numbers.
Oh, just say 80.
Okay, good. So there's a form that we typically have that we write this 80 down. All right. So, but with you, all we're going to do is we're going to do reps. We could do reps or holds to the good side. In other words, we could hold down there for 20 seconds, or we could do reps of like maybe 10 to 12 of them. What would you like to do?
Let's hold.
Gonna hold? Okay. So when we say, because again, this is a harder one, try to hold for 15 to 20 seconds.
Okay.
Okay.
You want to go as far as I can, or just about there?
That's fine. You kind of went to there, so we'll see what this does. 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. Good. And we usually do 2 sets before we retest. You can do 4 sets before you retest, but just as a base to get people understanding the process, we just say 2. We just chose 2. Some people like to do 3 before they retest. All right, now let's do it one more time. You can rest as long as you want to. 20, 19, 18, 17, 16, 15, 14, 13, 12, 11, 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Relax. Okay. Now, if you're ready, rested enough right now, retest. Now, again, this first time, you may not even think about it. It may be wonderful, but it may not. But you're paying attention to the quality. Don't just pay attention to the pain, because at the end range, even though the end range may be further, there still may be pain, but you're paying attention to all of it. So go ahead and retest to the right.
It's much better.
There you go. And you didn't have that like kind of sensation. It wasn't 80. We're trying to head to 0. Where is it?
What do you want? I'd say my first thought was a 40.
Okay, good. So if something works, so there's 3 rules, and that is if it works, do more of it exactly the same way. If it slows down, like it doesn't change or very little improvement, we tweak it a little bit. Maybe we'll do more, maybe more time. Maybe we'll do reps instead. Maybe we'll increase the speed. Okay, that's a little tweaks. Okay, but yours worked. So what should we do?
Do the same one.
All right, same one, same way. Okay. Now we're not trying to fatigue you. A lot of times people think this is all about effort. I don't care about that. If you say, boy, I'd like to know what it feels like if I went down further, but for less time, or if I didn't go down as far for the same amount of time, or maybe a little longer. It's up to you. Which would you like to do? Lower, less?
Further.
You're going to do what?
Further for less time.
Okay. And again, we kind of changed a little. We should do exactly what we just did, but we'll do it.
We can do that. That's okay.
Well, okay, let's stay pure to it. Go ahead and do the exact same thing for 20. But again, if it's too rough, and you need to hold on to something again, I'm not trying to be a bear with it. 15, 14, 13, 12, 11, 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Come on out. And again, Carol, it's when you're ready. All right. So when it's weight bearing stuff, people take a little bit longer, and I'm not in a hurry. It doesn't matter what you take. It's just as long as it's still improving as we do it. Get back up there, girl. You gotta do two sets.
Oh, no, I'm sorry, 2. All right, sorry. So do another one. Okay.
Now, you guys watching this, or eventually watching this, again, what's great about seeing this on camera is you get to see the quality of her motion change. You get to see the expressions on her face change. So you'll see that you cannot pay attention to pain because we don't feel that. All you can pay attention to is the quality of motion and the range. So.
Well, I'm really crooked.
All right, retest, girl. You were a 40.
About 25 now.
Excellent.
Yeah.
So now let's try. We have a couple choices. And again, the choices are yours. We could do lower and hold. We could do reps. We could do less, and we could do the exact same thing. We could do, what do you want to do next?
How many reps do you do?
15, 12 to 15, 12, whatever.
Let me go lower because that's really where my restriction is. I can't squat down. So.
Good. And you kept mentioning lower, so why don't you go lower on the good side?
Good.
Again, if you want to go lower and do reps, it's easier sometimes than holding them.
You mean like do this kind of thing?
Then just come all the way up.
Oh, okay.
Good. And then do it again. All the way down as low as you want to go. Go lower if you want. Yeah, hold on. You grab one of your chairs so you have a little bit more to hold on to if you want. Or back up a little bit and hold on to the door frame.
Yep.
Just move back a little. Move back those because I don't want you. There you go. Go down nice and low if that's what you choose to do.
I think that's 12.
That's fine.
Is that good?
That's good. We'll do one more.
Okay.
I know everybody in the beginning gets excited and wants to retest after one.
That was tiring.
And that's why we say is it's not about being exhausted about it, because you may say, oh, I treat these certain seniors, they'd never be able to do this, and we go, but that's because you keep using all the effort. I'm not telling you to use all this effort. We could do people that could go an inch at a time, and it's amazing what improvement they get. But let's do it again, one more set, just the way you did them. And again, 12 is just a magical number. You can do 8, whatever you feel like that's enough. We want you to say, I don't mind doing that. If you mind doing 12, then don't do 12. If you say, I'll never do any more of these once I get off the phone with Tom, then you're doing them, and you're doing just too much exertion.
All right, good.
Got it?
Yeah.
All right, so you're just going to go down and test the exact same way you did the first time?
Okay. On the good leg, right? Yeah.
On the bad leg now.
Bad leg. Okay.
Very nice.
That's really pretty darn good.
Okay.
About a 10.
Good.
Very little pain.
So this has happened to every single patient I've treated. Every single one. And again, you're a manual therapist, energy worker, craniosacral worker. You've got a pretty good skill set by the sounds of it, right?
Yeah, I think.
Well, and
this is what I had missing, I gotta tell you.
Yeah, what do you think about this?
I think it's wonderful.
Isn't that wild? I mean, it's stupid. And people go, well, you just gave us the concept, Tom. Why should we bother with a course? And I go, we've been doing this 10 years. This is just the beginning, because there's a way to fine-tune finding a problem. And there's more to, in other words, I can make that right side hurt again. I can make it flare back, probably back up to an 80. But you'd say, well, how are you going to do that? But that's the further of the concept. And then we've got a process. You were lucky that this one got rid of just like that. But
Yeah.
sometimes they don't. But we can tell people once they advance up through, you can typically get rid of most problems in 5 minutes or less.
So question, if this felt like a meniscus to me, because I've had one before.
Yep.
If it's a meniscus, would it go away like this?
Yes.
Okay, great.